Okay. So welcome to the Injury Prevention Plus Seek Wave 4 pre-work webinar. This is a summary of what you will expect in the program. Feel free to answer any questions as they come to mind. You can also use the chat for any questions that you have. I will be monitoring that, but feel free to speak out if you have any questions. So we want to welcome everyone and also thank our project partner, the Ohio Department of Health, Violence and Injury Prevention Section, or VIPS. On today's agenda, we will have a project overview, look at the data tools and project materials, talk a little bit about data submission, getting started, Pdsa, ideas, implementation, planning and questions, and wrap up and reminders. Okay, there are just a handful of us on the call, so I think we have time to go through this if you don't mind unmuting and answering the following questions. Who is on the call? What is your role at the practice? What drew you to the Injury Prevention Plus Seek program? And how many providers in your practice will be participating from your office? And I will just go down the line. I see Tracy K first on the list. Tracy, can you hear me? Okay, Amy, I see you next on the call. Do you mind introducing yourself? Hi, Tracy.
Hi, can you hear me?
Or Amy, yeah, that's better. Hi.
This is Tracy.
Hi, Tracy.
I don't even remember all the questions you asked. So,
okay, who you are, what is your role, why are you in this program, and how many providers will be participating from your office?
okay, so Tracy Caroli, I am participating because multi reasons actually. Obviously, MOC credit is important, but it just sounded like an interesting project and one that I think our practice does a fairly good job with already, but if we can improve, that would be great. We have 8 pediatricians, 2 nurse practitioners, and I know I'm doing it for sure. There may be one of my partners that is also, I'm not sure.
Okay, so 2 providers from your practice would be participating, correct?
Yeah, at most.
Okay. Okay, thank you for that information. Amy's phone, is that Dr. Lucky Do? Hi. I think you're muted. I'm sorry. Hi, Amy. Sorry, you're muted. Can you hear me?
Okay, how about that?
Great, better. Thanks.
Yay! I must have mashed the wrong button. So I have multiple hats that I wear. General pediatrician for the coroner's office here in Ross County. And I also work at the Child Abuse Prevention Center. So injury prevention is kind of my jam. I'm in an office with 1 nurse practitioner and 1 other provider. I'm not cleared their level of participation. We've also got just a new office manager who's just really getting her feet grounded, and she's even on vacation right now to be able to kind of help guide and be the den mom for this project. But that's us.
All right, thank you. Okay, Dr. L, if you could introduce yourself and help me with your last name, please.
Hi, I'm Hemant Lingadevaru. I'm a pediatric intensivist at Dayton Children's Hospital, and injury is one that we routinely see. So it's a topic near and dear, and injury prevention is one that we unfortunately can't in the ICU. We see more of patients who present with illness and injury, and it's always useful to prevent it among those who we see for other reasons. So that's the reason that I am interested in the program. As far as the number of providers, we are a group of 8 physicians in the practice and 2 nurse practitioners. So I would be talking more about this once I learn in extent about the program and introduce it to others in the office and see who all are interested. But it is a group of 8 with the 2 nurse practitioners.
Okay, great. Thank you all so much for sharing. We will learn a lot about each other over the course of this time. Project goals for the Injury Prevention Plus SEEK program include improving clinician screening and education in injury and psychosocial risks during well child visits for children birth to 5 years of age. It is a focused age group, birth to 5 years. And we want to implement project activities virtually to allow sustainability following quality improvement completion. Project aims include provide children with the opportunity to reach their fullest potential by eliminating unintentional and intentional injuries and psychosocial risks. The aims, as far as the numbers go, include 90% of patients get screened using the Injury Prevention Plus SEEK screening tools. For the submitted Injury Prevention Plus SEEK screening tools, caregivers who identified risk will have a documented discussion 65% of the time. A little bit about that number and how we kind of landed there. That particular aim was set because on average, families need discussion on 3 questions per visit. And this percentage was picked to reflect that we want at least 2 out of the 3 areas of need to be addressed. And the third project aim for submitted injury prevention SEEK screening tools, caregivers who identified risk or need will receive a referral and or resources 90% of the time. Project methods incorporate standardized screening into all well child visits for patients birth to 5 years, as mentioned before, of age, and then using 2 age-appropriate screening tools. So you'll see the breakdown in future slides. Provide discussion using evidence-based talking points with areas of identified need. Provide a family resource handout to all families with identified needs. You are also encouraged, and we will send you enough of these that you will be able to pass these out to all families that come in, regardless of age group. There's a lot of helpful resources that would be applicable to all families that walk in your door. And then we'll use QI principles to ensure screening, discussion, and resource provision occur consistently. Any questions so far? That was a lot to cover pretty quick.
Brooke, this is Hemant here. Quick question. Your project, the age and the setting, it indicates it's birth to 5 years, and it is in on patients who come in for a well child visit. With ours being an inpatient, would any other encounter be also included, like a sick encounter, because it's going to be an inpatient admission?
Haley Southworth, who is helping me with the program and has done previous waves in the past. Haley, are you able to shed some light on if that would work in this case?
Yeah, so thanks, Brooke, and thanks for the great question. We have worked with a hospital previously, and they were using their inpatients. So particularly, like perhaps even in the newborn nursery, people that were there. So yes, I think the main piece would be some consistency regarding who you deem as a patient that you could have for screening and data collection, and that it's pretty much the same type of patient every time. So if it's sick encounters, if it's once per admitted patient, you know, on the day they're admitted or the second day or something like that. Or actually, this could be a great piece if you're in an inpatient setting to incorporate into that exit discharge area, so that you don't necessarily like repeat the same patient every day, but see them once while they're with you. And we can definitely talk a little more about what ideas you have for how it can fit specifically.
Sounds good. Thank you, Haley.
Yes, that's good information. Hopefully, Doctor, you can take that back to your staff, that it can be implemented in a not just in an outpatient or doctor's office typically that we see. We can implement this in all kinds of offices. The participant dashboard materials for the project will be available online. We are working on this website. We will certainly get you the information when that is up and running. But it will include a link to the virtual screening tools, downloadable screening tools, the talking points, the resource pages, and Pdsa worksheets that you can use. You are very welcome to use your own Pdsa worksheet that you have previously used as well. The education module links and a link to resource pages will be available to you online. We touched a little bit on the screening tools, but here is a snapshot of the visual of the paper copy of the screening tool, ages 13 months to 5 years. This would be available electronically for you and for your patients to use, but we wanted to kind of show you the breakdown of the questions that will be asked. There are 2 age-appropriate screening tools, birth to 12 months and 13 months to 5 years. And both sets of screening tools have questions that identify risks of potential risk around intentional injury, unintentional injury, and social determinants of health. The screening tool is a hybrid of the injury questions and then the formal safe environment for every kid or SEEK questionnaire. You will get certainly copies of this, but here is a larger picture of the first set of questions on the screening tool. This one happens to be the birth to 1 year set of questions. The screening tools, we are moving everything online as much as we can. So you'll be using an iPad. We will be sending you that iPad for implementation for this program. With that includes the automatic grading and immediate data entry, which is nice. And if the online screening tool option doesn't work for you or your practice, we can discuss further options. It'll be in tablet form, specifically iPads. Caregivers will be given a tablet to complete the screening tool. It'll be preloaded into the iPad by staff. It'll be locked down to only have the questionnaire available, so no one should be surfing the internet when they are completing this. The caregiver completes the screening tool until they reach the stop page. The tablet is returned to the staff. The provider will see a pre-populated list of topics or the caregiver's answers indicated need for discussion. And the tablets will require Wi-Fi access and will be locked down, like I said before. And then we will certainly provide assistance setting these up virtually as needed. There will also be further training when you get the materials as well. The provider will discuss with the caregivers and patients the topics that need a discussion and then provide them with a resource handout. The provider should document in the tablet which topics were discussed and if a resource was provided. The tablets will loop back to the screening tool for use for another family. And in the world of COVID, just be mindful of your procedures around cleaning. Any questions on the screening tools? Okay.
Brooke,
Yes.
Brooke, quick question. This is Hemant here. Will the information collected from the family parents be anonymous without any personal identification?
Yes, absolutely. Part of the QI program, it is important to us to keep all the data collected anonymous. There will be no identifying factors. We only ask for the age of the patient to bring up the specific screening tool to be used for that age group, but we are certainly not linking data or PHI or anything like that to the patients in this case. Okay, talking points. There are 2 talking point documents, just similarly to the fact that there are 2 screening tools. They are separated by the 2 age ranges that we are studying here. And they contain suggested anticipatory guidance and answers for families who identify a need. Here is an example of the talking points that you will have available to you at the time of the screening. We were able to break these down by topic and subtopic. So in the blue line, you will see social needs questions. And in the parentheses, the subtopics under social needs include job resources, childcare resources, housing resources, and food insecurity, for example. Each question is identified by the subtopic that it relates to. So number one is a job resource question on the left in the gray box. And on the right, there are talking points that you can use that help you have the discussion with your patients and families. And it should serve as a link to the family resource that you will give them in the future. So you are able to, with the screening tool, identify the need, have the talking points, break the ice on having the discussion, and then hand them a resource before they leave your office regarding the social determinants of health and the injury questions. And a breakdown of topics and subtopics include car safety, which goes along with car seat safety, safe sleep, and that goes with the birth to 1 year only screening tool and talking points. Home safety includes firearm safety, first aid, home safety, poison control, smoke and carbon monoxide alarms, and smoking in the home. Family needs include alcohol and substance abuse, parenting skills, domestic violence, maternal depression and parental stress, and social needs, child care resources, food insecurity, job resources, and housing resources. Resources that you will have to be able to share with your patients, as well as an online version, are broken down in the national and state resources. If Ohio doesn't have something, there should be a national resource available. And this includes something easy to pass out to your caregivers and families that they should be interested in. Everything is all in one document. So if you identified something and didn't have time to talk about it that day, or feel that they could benefit from having other resources in their hand, they are given this resource, and certainly more information that they may need today is in that document, but they will have it for any future use. And we are putting all the resources available online as well. So you will get a version of the family handout that has all the relevant information, but an extended version is available online. You and the families will have a QR code at the top of the family handout, and it'll link to the SEEK website that has other resources available. And that is where the county specific resources will be available to be used online as well. Here is a picture of the family resource handout. The QR code and the link to the website is on the top. We broke these down by topic as well. And then you have the topic in the gray bar, social needs, for example, and then along the left, that includes the subtopics: job resources, family care resources, housing, food, and broken down by the Ohio resources if available, and national resources as well. Any questions on any of the resources? Providing a handout, family handout, or referring to the SEEK website is the only requirement for resource provision for this program. Further resources and referrals may be provided at your own discretion. Let's say you currently use something in your office, you can certainly continue to use that. We encourage that, actually. The more information the patients and families can have, the better. And we currently don't track or require follow-up to determine if a resource was used, but we think it's a great idea. And if you can easily capture that information, share it with us, that would be ideal. Okay. At the beginning of QI projects, we request baseline data to help us compare improvements made during the project, that how your practice looked at the beginning, and then during the program, and any improvements that were made during that time. For this program, the baseline data review includes 10 chart reviews per month per provider, seeking MOC credit pulled at random for visits during August of 2021 to January of 2022. Any charts for these for patients under 5 years old seen during August and January are required for this. So 60 chart reviews total, 10 per month. I just want to kind of stop there. Any questions there?
So Brooke,
Yes.
so those 60 are due by August 12th.
Yeah, we
Okay.
wanted to extend that date a little bit. There is some flexibility. If we know you're working on something and you need more time, that's fine. But August 12th is the date we are aiming for this.
Okay.
So while you are doing your chart reviews for the baseline, if you make a note that you have in your record in the chart of discussing or providing resources for the topic that our project covers, that is what we are looking for. But it's also okay and common if you find areas that there's no documentation to review. We know that we are capturing chart reviews and data that has taken place before the program. So if you don't find anything where there's any documentation around the topics or subtopics around injury and social determinants of health, we completely understand. And I will provide you, and most of you have already seen it, but if you haven't, I will get you the baseline data survey upon follow-up after this call. Any other questions on this? Dr. Crowley, that was a good one. Thank you.
Brooke, you said the 10 charts per month per provider. So is that okay if there is like the same patient that is reviewed by the other providers, because they would not have information of who the first provider has looked at as far as the chart being pulled from the electronic records?
Oh, I see. So maybe if two providers in your office are looking at the same chart report or something like that, they may not be clear of who pulled who.
Or they may end up pulling the same chart because it's from the electronic health records. And since we don't record any personal health information, they may end up pulling same charts. Is that still okay?
Haley, that's a good question.
Yeah, I'm trying to think through that. So if it is possible for you to look at which provider, like you would look at charts for patients you had seen, and then any other provider might look at, charts for patients they had seen. If the patient came in more than once and saw multiple providers, I think that would be fine. But I don't think it would be the end of the world if you accidentally had a repeat in the baseline, but it'd be ideal if you could check and kind of try to have providers report on patients they had seen.
Just in inpatient, the way it works is all the providers may end up seeing the patient during their hospitalization, just because we take calls and we take turns seeing the patients. Again, we can look at any particular ways to ensure that there is no duplication, but that may happen.
Yeah, and if you have enough patients, maybe it could be limiting it to one patient per, or one chart that you review for each day. And knowing there could be some duplication, that would be all right. And you're right, in the different settings, things occur and are tracked differently. So if it does wind up with some duplication, that's all right. Hopefully it won't be too much.
Sure, thank you.
Good question. Thank you, Haley. Okay, on to the plan, do, study, act cycles. To receive MOC credit, 3 Pdsa cycles are required to be completed during this project. August is a little tight. So again, there's flexibility in the August and September Pdsa cycles to be completed. We are here to help you with these. Again, you can use an existing Pdsa cycle worksheet, or we can provide one to you. Examples of Pdsas include implementing the screening tool, providing the family handout resource to caregivers, providing incentive items to caregivers, like cabinet locks, which we will be providing to you, following up on repeat visits for caregivers, have your own practice ideas and goals, of course, and then encourage your staff for ideas around this. Okay, there's been good questions so far, but has anyone thought of anything further to discuss on what we have covered so far.
Can you elaborate a little bit more on the Pdsa cycle?
Yes, I can. Haley, do you want to help us out with this too? I know the first rule of thumb on PDSAs is to start small.
Yeah,
I guess
absolutely.
like what is the process that we're going to be doing this with? I guess I don't understand.
Sure. And we have more information. I actually have like a 5-minute quick training video I can share with everybody about PDSAs. The concept of the Pdsa cycle is to track and document some of the steps you're taking to make changes related to the project. It can be everything from a handwritten list of my I'm going to improve, screening. My do is the MA's going to pass this out. Our study is we're going to check and see if there were, a lot of screenings completed. Your act is whatever you choose to do next. It can be very basic and simple. Also, though, it can be more extensive in the form of a worksheet, and we provide some samples of that. We can even provide a sample that's got information completed in it, so you'll be able to see some of what others have done. The goal of Pdsa worksheets is really just to help us see what changes you're making and help you also know the small steps that are more effective, or, if something's not effective, you can identify it quickly and throw it out and not waste your time.
So this is going to be like a worksheet or something that we're going to scan in and email.
Yes, although I will tell you, you can scan an email. You can have a typable version. We have some that are in Word. You can type right in your answers. I've also had people who take a cell phone picture, snap that and text it over or send it in that way. So lots of options that's easiest for your practice.
Okay.
Good question. Thank you, Haley. Any other questions around Pdsa cycles or anything else? Okay. Next steps around the program. I will be sending out to the group a program timeline. It's a breakdown of the activities that are due monthly, the Pdsa ideas, and tracking for practice goals. And I will submit that in the follow-up to you, along with these slides and any additional information. Data collection requirements. Like we mentioned before, we'll be using the online tool. After the baseline, no chart reviews or additional data is going to be required for data collection for this program. Ideally, the data will be calculated within the first week of the month following data collection, and individual data needs could be evaluated and discussed to make sure submission goes smoothly. So our touch bases, our one-on-one touch bases, we can go through any questions or any pain points that you are feeling during that time. Also part of the program are the action period calls. One extra period call will be held per month. They are going to be about 45 minutes. Your entire participating team is encouraged to attend, but we understand that that might not always be possible. So at least one member of the team must join. Calls will be recorded for reference and sharing. They will be scheduled the fourth Wednesday of every month at 12:15. And right now they are scheduled for August 24th, September 28th, October 26th, and November 30th. I will be sending out calendar invites similar to the one that was for today's call around these calls as well. And the practice coaching calls, we can have these starting in this month or September. Any questions that you have around the program, any pain points around data or data collection, we can talk about here. Anything that you see come up. So August, September, if you could schedule a good time and date with me for this, we can even as far out as now schedule the November one. So that would be more around the exit interview and the wrap up at the end of the program. Call dates will be at your call, whatever your availability is, and it can be anytime. And additional calls, of course, will be scheduled for practice-specific assistance. You have my support, and you also have Haley's support during this time. Opportunity can be personal assistance, discuss office flow, Pdsa cycles, and plan sustainability pieces, which is going to be closer to part of the program at the end. And around MOC credit, the physician team leader within the practice will need to attest for each physician's meaningful participation at the project end. To receive credit, a team must complete and submit 3 Pdsa cycles, attend practice coaching calls and or action period calls 3 of the 4 months of the program, and submit data for at least 10 patients per month within the action period time of the program. And this program is worth 25 points Part 4 MOC credit. Okay, and for next steps, we talked about this a little bit, but if you haven't done so already, if you could complete the pre-work survey and the baseline data poll surveys by August 12th this year. If you need more information, that's absolutely fine. We will be in communication on what is realistic as far as dates, and if you need to extend anything. We will be getting to you in the mail next week. Printed items, the talking points and the resources are going to be coming to you, the cabinet locks and the iPads to be used within the program. And again, if you haven't already done so already, if you could get me a good snail mail address for your practice, including who I should put the information attention to. Once you get everything for August and September, begin using the screening tools in office and collecting data during the month of August. Please email and schedule the August or September practice coaching call as well. And then we have the learning session that is scheduled for Wednesday, August 10th. That's coming up. We will be recording that and that will be made available, but certainly you are encouraged, you and your staff, to attend that live webinar. Live virtual webinar. Okay, that was a lot of information. We do have time for questions and discussion if anything has come up. Haley, do you have anything to add at this time?
No, I don't have anything else at this point, but as Brooke said, we are happy to address questions. We have a lot of training materials that are available, some recordings on QI, and we can also have a scheduled one-on-one call if necessary. If this is a new process, if QI is something you haven't really done in practice too much before, we've worked with people who have also been their first QI project on this exact effort. So it would be great to share anything that will make you feel more comfortable getting going. And really excited to have you meet the rest of our team at the learning session and through these action period calls, because I know they are all very excited to have you participating too.
Thank you, Haley. You at this point have my email. You can submit any questions that you have or any needs that you have via email. Feel free to call me as well. I will be keeping you posted mostly via email on next steps, next dates of actions, anything that is due, any links that you have. Certainly follow up after this pre-work. So keep an eye on your email for more information from me. If we need to do things differently, get information to you differently so you see it in a more timely manner, or so it doesn't get buried or anything like that, we can work around any needs that you have.
Brooke, quick question.
Mm-hmm.
For the Pdsa cycles, is it 10 patients per month per practice or 10 patients per month per physician or per person?
I think, yeah, Haley, please correct me if I'm wrong, but we're talking about maybe 2 different things. Pdsa cycles, one worksheet would be submitted 3 times during the program, the beginning, the middle, and the end, preferably. And for the data collection during the action period of the program, we're going to need 10 charts or 10 screening tools completed by each provider during the action months. Haley, is that correct?
Yeah, so Pdsa cycles are something that is shared across the practice. So your team can submit one of those as a group when you submit those. When we're thinking baseline data and action period data, that would be for each provider. So like Brooke said, yeah, some of it is group activities. The data is more individualized.
So just to verify, the initial data collection as far as the baseline is the 10 patients per month per physician. And then the Pdsa cycles, each cycle would be only 10 patients per month per practice. It's a group effort, and it would be total 10 that the practice would be submitting.
So the data collection, when you get into the action period, is the screening tools themselves are what's submitted for data. So if you're screening every patient, that's what comes in as your data. So it hopefully will be pretty seamless. You don't have to pull chart reviews. So it would be ideal that you get the process into place and you're screening, a consistent number of patients. I think it's the at least, yeah, it's set as at least 10. But if you are able to make the screening something that happens consistently during those action months, we would hope you'd see more than 10.
Sounds good. Thank you.
Good question. Dr. Lucky Do, have you moved outside? Yeah. Dr. Lucky Do or Tracy, any additional questions?
I think I'm good for right now.
Okay. Good. Thank you. Thumbs up. Thanks. Thank you, everybody, for attending today. I will be reaching out with more information, but if you have any questions in the meantime, please don't hesitate to reach out. And I appreciate your time today. Thank you.